All right, so we had this scenario in which a patient came in and they had two different blood pressures on both arms and they had tearing back pain. And we found out that we were cooked because the patient has a aortic dissection. So how can an aortic dissection cause two different blood pressures in the two different arms? And why is it a good assessment tool for assessing for dissection? So your aorta has these offshoots. The ascending aorta has these offshoot branches that feed your right and your left arm as well as your brain. So over here we have our left subclavian artery that goes and feeds our left arm. And then off over here we have our brachiocephalic that then goes into our right subclavian that feeds our right arm. And so with this, when we have a dissection, it involves a false lumen and a true lumen. So with a dissection, basically the intima and other layers split off and we get that dissection, and now we have a false lumen which blood can now go through. And this false lumen causes a bunch of issues for us. So one way that it can occlude one of these arteries and cause a decrease in blood pressure in that limb is that during systole, it can actually push the false lumen and occlude the offshooting artery. The other thing that it can do is if the dissection actually goes into that offshooting artery, it can cause clots and actually compress the true lumen of that artery and cause a decrease or even a cessation of blood pressure in that limb. So this is why it's so important that we do these assessments where we're taking different blood pressures in both the upper limbs, both the lower limbs, and describing our findings to the doctor. And then of course, getting that CT scan as soon as possible if we see something like this coming up in our assessment.